Karen and Kristy, we just saw a small snippet of your family's story, of Otto's story. So would you care to give us a little bit more detail?
Well, at Christmas time in 2017, Otto started not really feeling well. He normally walked 5 miles. He was very active, and he just wasn't feeling well. And one Sunday, we were getting up, getting ready to go to church, and Otto never missed church. And he said, I can't make it to church today. He said, I really think we need to go to the hospital. Well, I was very alarmed because Otto was not one to ever go to the hospital unless it was very serious. And so when we went out to the Norton Brownsboro, he was diagnosed with cancer. And of course, we were floored. After that, then, of course, we went to the doctor, and he started chemo. And to make a long story short, he didn't, he put up a good fight, but he didn't tolerate the chemo very well. And he, started going down. And then
we didn't realize how fast it would
occur.
Progressing. We thought we would, go to one more football season. We thought, okay, well, maybe, because I got engaged while my dad was sick. We had already, my boyfriend at the time, my husband now, he had already planned for it to be February 24th. Dad got diagnosed January 21st. So he went to Mom and said, hey, do I need to move the date? But they said, no, you've planned a wonderful thing. And at that time, we still thought, oh, we have months.
And your dad was a giant of
Yes.
a man and an athlete.
He was our big fish.
Yes, yes.
Very active, healthy,
Yes.
exercised every day.
So it was a surprise.
It was totally a shock.
But so then he didn't tolerate the chemo. You were getting engaged. And so what happened next?
We decided, we were planning for a June wedding. I went and got my dress at Rebecca's, and it was wonderful. Luckily, it fit, and she let me buy it off the rack. Things just fell into place, but Dad wasn't able to take one of his rounds of chemo, and
he ended up in the hospital, and the doctor told me that he was...
If he was a plane,
he would be going down, he would be skimming the trees.
And he was being, you knew this doctor, and he was being
absolutely.
just brutally honest and
which is
realistic.
what we needed.
Yes, because we were planning, I was thinking a June wedding, and I thought he had months to go. And it ended up being 7 weeks. And so he was in the hospital because he had some complications. And they, after the doctor came and said, I really need to consider hospice. Mm-hmm. And I was thinking hospice at home, but Otto wanted inpatient hospice.
And why did he want that?
Well,
he had a specific reason for that.
Yeah, I think he said, he had told us that he really wanted not to be in this house where we all,
because I've lived here since I was born.
Right.
And he didn't want the last memory to be him in a hospital bed.
Well, and the doctors thought because he was a big, strong man,
mm-hmm.
It would be difficult for us, even with hospice coming into the home, to adequately take care of him. What we didn't realize was how quickly, once he went to hospice.
So let's move to that. So he is in care of
He's
Hosparus
in the
Health.
Inpatient care downtown Louisville.
And then the wedding.
So we had bumped it up. We were like, all
right,
Sunday.
It was Sunday when we moved to hospice.
And we need to do it Friday.
Next Friday we were going to do the wedding.
The more that my dad thought about it, he goes, Friday's not going to work. I think Wednesday. And you were like, okay, well, Thursday, Tuesday. He's like, Wednesday.
It was already Sunday.
So he knew.
He knew.
I think
because you got married.
On Wednesday.
And then what happened?
And
on Friday.
We all woke up Friday morning and he was gone. He was with Jesus.
But it was wonderful. We got to, they had the hospice room. The Erica.
It was a new wing. They had just opened up.
Mm-hmm. Yes.
And my sister, my brother-in-law, my new husband, me and my mom were all able to sleep in the room on recliners with him.
So you were there.
That one last night.
Yes.
You were absolutely there
so
together
special.
as a family.
They made us so comfortable. They made my dad so comfortable. Oh my goodness, I cannot rave. We're both nurses, and I could not stop raving about how
And
comfortable.
we had so much company, and they were so kind, and
They never once made
They
us feel.
embraced
They
you,
did.
but
They
in
did.
turn, you have embraced them. And I mean, Otto's legacy lives on. We only have a few moments left, but can you explain how you've truly embraced them?
Well, after I got married, I moved to Bowling Green, and luckily, Hosparus is also located in South Central Kentucky. They serve, I think, 36 counties. So I was, I'm trying to find a way to plug in there. Like my dad said, you have to plug in to your community. You have to give back. Time, talent, treasure. And so I figured out Hosparus was down there, and I've decided to volunteer. And I'm so excited to give back in the very different ways that we can.
And Karen, you as Otto's, much loved wife, would encourage others.
Oh, absolutely. I think Hospice has really helped our family with all the preparations for the wedding, along with family
Absolutely.
members, and it's just the openness and love they showed to all of us.
You're, forever members of the Hosparus Health family. You truly are. And coming up later in the show, we'll meet even more members of Hosparus Health's family.